Every once in a while, I get a really credible tip from a nurse who's whistleblowing, and I got to tell you a little bit about this. So an Ontario hospital just fired 59 healthcare workers, and their union didn't even know that it was coming. And here's what you need to know what this might mean for you as a patient coming into those walls. So Quinte Health, which runs Belleville General Hospital and Trenton Memorial Hospital, just announced that they're eliminating 59 personal support workers and healthcare aide positions. That's like 15 full-time workers, 27 part-time, and more just gone. Oh, I failed to add the most crazy part. They are replacing these 59 PSWs with 8 RPNs. 8. Over a 5-month period. The units are 4, 5, and 6. That's inpatient surgery and 2 medicine floors. We can't lose people on medicine floors. Or really any unit, to be honest. They've already moved PSWs from the ER, and now they're pulling them from these units too. And what you have to recognize that if they remove other health workers that are helping within the healthcare team, that work still has to be done, and that falls on someone else, the RN or the RPN. But here's what makes this story worse. The union, Unifor Local 8300, had absolutely no warning. Workers found out and hit the streets. They held a rally outside of Belleville General, and the Unifor national president called this part of a disturbing trend happening all across hospitals in Canada due to chronic underfunding, staff stretched to the limit, and resources being quietly shifted towards more and more privatized healthcare. They're saying that the registered practical nurses can take on those roles. And they're already really stretched thin, so how does that make sense? And from my understanding, the hospital hasn't even confirmed how many new RPNs they're actually hiring. PSWs and RPNs do very different things. RPNs assess patients, monitor conditions, administer medications. And PSWs typically are the ones that help patients bathe, eat, and get dressed, move around safely, and kind of that hands-on dignity care. That work doesn't just disappear because you eliminate the role. It either gets left undone or it gets downloaded to the nurses who are already overwhelmed. And that's exactly what's going to happen. If you're hearing this around your hospital, I'd love to know, because we can't keep hearing these things and not do anything about it. When we cut staffing services, we know at the end of the day that means less patient care. Unifor is taking this fight to Queen's Park on May 28th alongside of many other healthcare coalitions, and there's a massive march planned from Union Station to demand action on healthcare staffing and funding. If you care about public healthcare in this province, you need to be there.